Everyone. We're glad you're here. We're live on Facebook, we're on Zoom, or you may be watching this video later. My name is Pam Bertolo, and on behalf of Flagler Open Arms Recovery Services, your local RCO, I am excited to present Renee DeAngelis this afternoon. Renee was with the Opiate Task Force from the inception. She led the whole education piece. And now she is leading the education for Flagler Open Arms Recovery Services. This afternoon, she's going to tell us all about Narcan. So Renee, thank you so much for joining us. I'll ask people to put their questions in the chat room or wait until you take a pause to ask questions. And with that, we're going to let you get started. Welcome.
Okay, thank you, Pam. I'm doing my presentation today on Narcan. It's something that's very important to me for people to know about. In 2017, my husband and I, our family, lost my daughter, Savannah. And if I would have known that Narcan was available without a prescription, I probably would have had it in my home when this happened. It became available without prescription in 2016 in Florida, and I was unaware of that. Even though when the emergency services people arrived at my home, and they were there first before the sheriff's department, they did have Narcan with them. We weren't successful in keeping Savannah here with us. And like I'm saying, I knew the emergency services would have it. When we called 911, I was not aware that I was allowed to have it in my own home without a prescription. I was not aware it was available. So anyway, that being said, I would like to do a little bit of history about Narcan, just in case there are people who don't know certain things about it. The actual drug is called naloxone. It is an opioid overdose antidote. The brand name is Narcan, and sometimes it also goes by the name Evzio. It was patented in New York in 1961, and you might be interested to know why it was developed. They were initially using it for constipation caused by opioid use. A little bit of humor there. And they found that it actually worked as an antidote for overdose. It has been available by prescription since 1971. And as I had said earlier, a state law was passed in Florida in 2016, allowing the sale of Narcan with no prescription. Okay, normally, if you go into a pharmacy, just as some side information, if you go into a pharmacy to buy Narcan, you do have to ask for it at the pharmacy counter. It is not sold on the shelves for obvious reasons. It's behind the counter, and you have to ask the pharmacist for it. But again, you do not need a prescription for it. Most insurance plans cover it. Some you might have a co-payment for, some you might not. It is covered with a prescription by insurance, but it is available through insurance also. If you go in to buy it out of pocket and you want to pay cash for it, these are some prices you can compare. At Walgreens, it's $198 for 2 4-milligram containers. Okay. Walmart, it's $144. At CVS, it's $134. And if you use a prescription card, such as Single Care, you've probably heard of that, the price at CVS will be lower to $125. Also, you can order it online if you do not want to go to your local pharmacy for it. I actually found a site called Naloxone Exchange, NXG, and you can purchase it online. Though I don't know what the pricing was. I could not get on there to find out the pricing unless I wanted to place an order. So, but nonetheless, we do know it's available online if you don't want to go to your local pharmacy. Okay, and then also Pam had found a website which she posted on the OARS Facebook. that there is a website called projectopioid.org, and you can get one free container of Narcan apparently through them. And again, what it would be is it would be 2 of these in a box. It would be 2 4-milligram nasal sprays in a box. Now I would like to talk about overdose for those of us who don't know about it, though I think most of us probably do. But just in case there's someone listening who does not know the signs of overdose, there are several, and it could be 1 or more of these signs. No color in the person's face, and their face feels clammy. Blue lips and fingers, non-responsive to their name, non-responsive to a very hard sternum rub, snoring or gurgling, and slow or no heartbeat. Now, let's assume that you do have Narcan. What do you do now that you realize a person is having an overdose? Call 911. Okay, get out your Narcan. And I have a page here that I usually give out when we're at First Friday and any other events where we're speaking about Narcan. And it tells you how to administer it. Lay the victim on their back, remove the Narcan nasal spray from the box, peel back the tab with the circle to open the Narcan nasal spray. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. So there we go. Tilt the victim's head back and provide support under the neck with your hand. Insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the bottom of the victim's nose. Press the plunger firmly into the nostril to give the dose of Narcan. Remove the Narcan from the nostril after giving the dose, and place the victim in a recovery position, which is on their side while you're waiting for 911. Now, you can also administer breathing to the victim by pinching their nose and taking a deep breath, a slow breath for 5 seconds and breathing it into their mouth. And you could continue that for 2 to 3 minutes. If they don't respond, give them the second dose of Narcan that is in the box. That is why 2 doses come together, just in case they aren't revived the first time around. And continue the breathing and continue to wait for 911. Other information I would like to move on to discuss now that we've discussed overdose and how to administer the Narcan. Okay, according to the American Public Health Association, just some little factoids, if you do have Narcan in your home or on your person or at your business, the expiration date, it is actually good for a year after the expiration date that is on your container. So it is still useful for 1 year after the expiration date. You can also find numerous Narcan training videos on YouTube. One put out by the company that manufactures Narcan, which is a really good, straightforward video. It's very easy to follow. Also, the CDC and the Surgeon General recommend that those closest to Narcan, to opioid users themselves, whether they're taking their opioid with a prescription or not, okay, those just out of a rehab program or those just out of prison and your general good Samaritans should all have Narcan nearby. And this is recommended again by our government, by the CDC and the Surgeon General. They're really working on trying to remove stigma by recommending people have this around, just like you have any other medical product around your home or on your person. Okay, also something for people to know. The Opioid Antidote and Overdose Protection Act protects good Samaritans. A lot of people are afraid to help somebody in distress, having an overdose and so forth, because they're afraid that somehow there's going to be some liability put on them or they'll get in trouble somehow legally. And that is just not so. Laws protect people when they're helping other people. And to move on to that, another thing to know is Narcan is not harmful to anybody. We learned in our seminars that you could give it to a baby You could give it to your pet, not that you would need to do that, but that's how harmless it is. It has no side effects, which I would like to move on to the next subject, which is very near and dear to my heart, and that's removing the stigma around using Narcan and people who have SUD. We had some experiences when we worked for the Flagler Countywide Opioid Task Force at one event in particular that we attended every 3 months. And with COVID, we haven't been there since March, but it's Access Flagler First. And that event is made for vendors who have things to give people in the county who are in need. And we had a supply of Narcan donated to us by another person in Volusia County at the time. And we had probably between Kathy Dalton and I, maybe about 30 containers of Narcan. And yet we were told when we were accepted into the program and we were able to attend the event and we wanted to educate people about Narcan and dispense it to them, we were told we could not bring the Narcan in the building. And that was because the people running the event, bless their hearts, had no idea of what Narcan was. They were just totally uneducated about it. And a lot of times people think that you're bringing methadone or even Suboxone, but a big misconception is that Narcan is a drug, an opiate, a narcotic, like methadone or other drugs that are used to help people with SUD. And so I'm really, really interested and dedicated to making sure people know how harmless and how helpful this antidote is. And so again, I want to remove stigma from the drug itself, and also in conjunction with that, the whole idea of SUD. It is a disease, it is a brain disease. It does not matter how you got there. Once that chemical is in your body, it will affect your brain. And that's how we as a society have to start looking at this. So anyway, some other information, plans for our education committee for the future, once we really start to get past the COVID thing and so forth, is when we get our Narcan grant, not only would we like to distribute it to the obvious sources in the county that need it, you know, people who are in pockets of the county where there are obviously substance abuse issues. We would like to distribute it at our events such as First Friday, which we usually attend on a monthly basis. And also what I would like to do is distribute it to corporations, small businesses, restaurants, gas stations, because these places, especially gas stations, especially places that have public restrooms, such as fast food restaurants, gas stations, that's where people use. That's where people buy their drugs and go in to use. And it would be a really good thing for our community and really all communities to ask these corporations and small businesses to have Narcan accessible to them behind their counter or somewhere in their store or business where they could get a hold of it easily in case they suspect somebody is overdosing. And in conjunction with that, we could train them as to how to dispense the Narcan if they agree to carry it. Okay, and a couple of examples I have to use here are very recent. Since the sentencing of Joey Colon, the drug dealer who sold my daughter her drugs, I've heard from a number of mothers who have lost children. I've heard from 3 or 4 mothers who sold the article on Flagler Live and in the other newspapers who got in touch with me. They found me and they got in touch with me. One of the mothers, her son, died outside of the Winn-Dixie in Palm Coast in a car. And the other mother, her son died outside of 7-Eleven over near Halifax Plantation in his car. If these 2 businesses would have had access to Narcan or even known what was going on or what to do, who knows, maybe these 2 could have been saved also. And so they're just very recent examples. These both happened within the past few months, within the past, I'm going to say 3 to 4 months, these two fatalities. Okay. I also did a little homework and called Advent Hospital yesterday. I called the emergency room because I had heard rumors that they were going to be instituting peer support for overdose victims who were brought in. And before they were discharged, they would have some kind of peer support and literature perhaps given to them as to where they could obtain help. And like I'm saying, I heard this kind of a rumor, and it sounded great because the task force in its day has been pushing for the hospital to do this because there's so much, it's such a burden for law enforcement and for the emergency services to administer the Narcan and save lives, only to take the victims to the hospital and have them discharged and begin using again immediately. And it's because they wake up, they have no idea they've overdosed, and all they know is they need their drug because now they're going into withdrawal. Anyway, so I called the hospital and I talked to a nurse in the emergency room. And I put this past her about the peer support and so forth. And was there any kind of outreach or, any bridge for these people to get from point A to point B without going out and using again? And she said, not that I know of. And she said, if there was a program here for that, I think we would all know about it because we'd have to undergo some kind of instruction. So that's where the hospital stands. That's where the hospital stands on it right now. It doesn't mean they don't have plans to do it, but from what I can see, it still hasn't taken place yet. So that might be another thing for OARS and the Education Committee to think about pursuing in the future, is to kind of get more involved in that. And did you have anything you wanted to add?
Perfect.
Okay. Another thing, I just wanted to add a little fact I found out recently is that the Flagler Fire Rescue emergency leaves Narcan behind. When they go to rescue a victim and give them Narcan, they leave it behind, which I think is like a wonderful idea. So I just wanted to kind of put that out there that they're doing that, they're being proactive. Some other news that isn't good, but I think people should know about it, is the Flagler County Sheriff's Office, as of the 10th of September, announced on Flagler Live in an article that had taken place that in 2020, they've taken care of 179 overdose calls. Okay. They treated 179 people, 17 were fatalities. And as of yesterday, there's been an 18th. Somebody my daughter knows, my older daughter, Christina, died, who she's known for probably almost 20 years. So it continues, and I just think people should know. It's not good news, but it still needs to be known. And then the last thing, which is really a nice way to kind of close my discussion, is Leslie Nelson had been to a seminar. I don't know if she actually attended it or was on a Zoom meeting with the way things are nowadays, but she heard this great idea, and it could work for COVID and even well after COVID is over, to have a drive-through event somewhere where once we get our grant for the Narcan, we could actually give out free Narcan at a drive-through event with other services that are offered, maybe mental health services, passing out phone numbers, information, whatever we can gather up to go along with the free Narcan. And I had an idea, though I haven't spoken to anybody yet, that maybe we could do it at the fire stations in Flagler County, because the emergency workers are quite used to administering Narcan themselves, and they're very used to the whole concept. So it might be a great idea to pair up with them and do an event together. And, we could even add in maybe a little Narcan training on the spot or whatever. It's just, it's something in the making, and it's something we can think about for the future. And that's about what I have to say. And Chip, do you have anything you want to say?
Oh, you were perfect.
Okay. Okay, well, that's pretty much my presentation. If anyone has any questions or anything to comment about.
Hey, Renee, it's me. I have questions. The Narcan itself.
Mm-hmm.
So it goes into a single nostril, right?
Yes, just one nostril.
How do you have any idea how often people have to use both? Have to do a double dose?
I don't have an idea how often, but what I do know, and I just read this last night, that if fentanyl is involved, there's more of a chance that they will have to use the second dose. But I don't have any statistics of how often it happens, but it is something to keep in the back of our minds if we know fentanyl is involved, kind of to be on standby for that second dose.
Pam,
the second dose,
excuse me, Renee, our sheriff's department and the EMS people, are they using the 4 milligram now instead of the 2 milligram?
yes.
Okay. Because I know earlier they were using the 2 milligram and more often they were having to do multiple doses at that point. So the 4 milligram should have reduced the amount of those.
Yes, absolutely.
Okay.
That's what's great about the 4 milligram.
Okay.
And also just something to add in back to your question, Pam, if you have to give a second dose, the logic would be to use the other nostril if that happens.
Right. And I think it's important to reiterate kind of what you talked about. If people have Narcan on them and they find somebody that looks like they've overdosed, it doesn't matter. Give them the Narcan. It can be for anything else, and it's not going to have a negative effect on those people. So the only thing it can be is a positive effect. So if you find somebody that's just passed out for whatever reason and you don't know what it is and you got Narcan, give it to them. You're not going to hurt them, and it can only help.
Yeah.
It can only help.
Yeah, I'd like to thank you very, very much for this, because I'm like a person that is huge on Narcan, especially in Flagler County. Narcan saved my life, my fiance's life, my sister's life, my child's father's life, his sister. I mean, it's just everybody, and we would all not be here if we had not had somebody that either had Narcan or the EMTs got there in time to give us Narcan. And so I've had so many people stigmatize me giving Narcan to people that are using, because that's what I'm big on. People that are using need to have Narcan on them, because I mean, with the batch, especially that's going around right now, I mean, I was told there was 5 overdoses yesterday in the Mondex.
Oh, okay.
And like, if they don't have Narcan in the house that they are in, then who's going to be coming to bring it? You know what I mean? By the time they get there. So I'm so big on the person that's using having some Narcan in the house. And so many people have told me that that was wrong and that I was doing something wrong because I was basically giving them excuse to do more dope. And I 100% don't believe that that's true. I think either way that they are gonna use more. And I was the type of addict that would OD in the morning, and then that night I would do the same exact thing that I did that morning and do it again because I couldn't stop. And so I'm so big on destigmatizing it and letting people know that regardless, they're using, you know, so at least they have something that might save their lives, you know, if they do. And so thank you so much for letting, you know, everybody know and putting it out there and destigmatizing it. And also I did hear that after like 40 minutes with the potency of the heroin and fentanyl that's being used right now, after about 40 minutes of doing the Narcan, just one of them, they start going back out. Like they start ODing again after the 40 minutes. So if there is another one, it's really important to keep that one, if you didn't have to use it, for after the 40 minutes. If 911 wasn't called, sometimes that is a factor and they don't want to call 911 because they think they're going to get arrested. And that's not the case either, you know. So I just wanted to put that out there, that that to keep that handy for after 40 minutes, they start going back out. So thank you so much.
Well, thank you, Danielle. I appreciate it.
And to the subject of certified peer support specialists, which Danielle has just become our #1 in their county. Once that starts happening and we get more people involved in that, that'll reduce the amount of double dosing after they've come out of the hospital. Because if they got no place to go, if they got nobody to help them get there, they're going to go into withdrawals again. And if the withdrawal can't be handled because of counseling or peer support or whatever, they're going to OD again. And that's why we see sometimes multiple uses of Narcan to the same people. So part of our education and destigmatizing this use of Narcan is to let people know why it's happening so they can be part of the solution and not just crying out on stuff they don't know anything about.
Yep, absolutely.
Hey, Renee. I know that you and Kathy Dalton keep a pretty close tabs on overdose deaths. And I too saw that article, the 179 overdoses, which was up 189%. My question to you is, do you know, or maybe Danielle, you know, or Katie, maybe you know, those numbers like that the sheriff reported in that article, or those numbers, Renee, that you and Kathy gather on the deaths. Is anybody collecting the number of overdoses that are not where an EMT, where the sheriff's department is not involved?
There's probably not, I don't really have a real clear-cut answer on that. I know through the time that I've been accumulating this information, I periodically will get it from another source than Kathy, directly through the police reports. I probably have a handful of them. Actually, the one that I just spoke about yesterday, my daughter found out she just lost somebody she knew through most of her life just yesterday. I found out through my daughter. I didn't find out through a police report or anything. And I know it's true because she was pretty close to the person. I know it's not conjecture, you know. And there's been a handful that I found out about that way, just through another person. And then there's a few that I found out basically on Flagler Live that were not police reports initially that came to me through Kathy. So yeah, they're out there, and it's kind of hard to ascertain, like, because I'm saying, like, every once in a while I'll hear about one from another source. So I mean, it can only be the tip of the iceberg. That's the way I look at it.
Well, if anybody knows a way to gather this data eventually, let me know, because like Danielle, you just said you heard about 5 more in the Mondex yesterday. I was talking to a woman who from Bunnell, and she told me this morning in graphic detail about 4 overdoses this week there. And when she used the term overdoses, she wasn't talking about surviving. So I feel like, and when I talked to Karen Prather, she feels like her stats are not necessarily compiled with other people's stats. And I feel like the only way that Flagler is going to be able to get the kind of help we need financially is that we've got to be able to get all these stats in one place. So
yeah, sorry, it is really hard to get those statistics unless you actually know somebody who was at the house or somebody who was, you know, involved in whatever was going on. And a lot of people don't even want to talk about it sometimes after. And that's, you know, the scary part is that people try to hide it. And when it needs to be out there because it is such a serious thing. But I have passed out over probably 75 boxes of Narcan in Flagler County, 2 addicts or 2 people suffering from SUD. And they're being used. if that says anything. Like they are being, they're not just sitting in a drawer, the boxes are being used. And it's a scary thought, you know, because those aren't even being reported until it happens again and they don't have the box and then the EMT comes.
Right. The reports are only going to be if EMT and the sheriff department show up. And if they can combine those.
Go together, Michael. That's
No, I understand that, but I'm talking about, I agree with Danielle. There's many more of overdoses that don't end up in deaths that aren't reported because those people that are involved in it don't want to get involved. And I don't know how you extrapolate that number, but it's going to be a much higher percentage than people realize, that people are in that position that have come through the overdose, didn't die, didn't have EMT, didn't have the sheriff's department. And because of people like Danielle and others that are handing that out, those people are alive. And hopefully at some point in time, they're going to reach out for help. And we need more of the certified peer support specialists in our county so they can be all over the place so people can reach out and get that kind of help and direction. And as OARS continues to grow, to have a central location where people can call in and say, where do I go? How do I get the help?
Mm-hmm.
You know, if we get a detox center, all these kinds of things, it's going to be a slow go. But I think because of the effort that OARS is putting in, it will happen. So we got to keep a positive thing at this point. We're moving forward. It's a slow move, but it's a move.
This is Leslie. I just want to say too, I think that with OARS, it's like there are several people that are involved with that and other organizations like the Flagler Countywide Opioid Task Force. There are a lot of different groups here in our county who have been working toward helping this area, but OARS has kind of organized them together. And together we do have a little more power. And also OARS is supposed to, and the product of an RCO is based on the needs of the community. And with everyone getting organized here from these different organizations, we can see there's a huge need. And need is what drives answering the problem. So the other thing I wanted to ask was, I know that you had mentioned, Renee, that the EMTs leave a Narcan. Are the people that show up at the hospital given a can of Narcan to take with them?
I can't imagine that they are at this point. I mean, I'm not 100% sure, but with my conversation with the ER nurse last night, I can't imagine it's happening because she was not aware of any kind of support or anything that is being provided at the hospital right now. And so I wouldn't think so, you know, from my conversation with her last night.
The
Sure.
only way that's happening is that whomever the EMTs, if they gave it to that person, put it in their pocket or gave it to family members where they picked them up, that'll be the only place that at this moment, until they get a certified peer support specialist at the hospital in the emergency room. What they've been talking about for months and months and months. I know SMA was talking about working with them to get that done. I don't know where they are in that process though.
It would just seem to me that the hospital would not have to wait to get a peer support specialist to be able to make that protocol if they have someone who comes in with an overdose that before they release them, they're given that. They could do that on their own, and maybe we need to approach them about that. I had 2 or 3 things I wanted to say that. I also wanted to say too, is it possible, does Flagler County have its own coroner? No. Does it go to
I don't believe so.
Volusia?
I think that's all done up in St. John's. I
I
believe.
think it goes to St. John's also, right?
Okay.
Yeah.
Yeah. Do you get any kind of feedback or any kind of numbers there? Does the coroner keep track of how many of the deaths that that are presented are from overdose?
I've never even thought of asking that question. It's a good point that you have, Leslie. And actually, I'm going to write it down here in my to-do list because
Well,
I've never thought of that.
You all know how my brain works. I flit from one place to the next, and that one just popped into my head. So there you go. But anyhow, I just want to kind of close my little point here is I want to thank Danielle for what she's doing, getting the Narcan out there to the people that need it. It's why it's made. It's there for a purpose. It needs to get to the people that need it. And also thank you, Renee. You have been relentless and just determined, you know, to make a big dent and a big impact on helping our people in our county recover. And so I want to thank you for that. And thank you for today's session. It was very informative.
Thank you, Leslie.
Mm-hmm.
If somebody could give me the information to contact Advent Health, I will. I mean, I'll go there to talk to them about whatever, you know, and I've said that before. I just don't know who to talk to.
So
Either
Danielle, can you just hold off on that just a couple of days? Because there's some stuff going on there that let's just hold off.
Okay.
And then, yeah, we'll see if you can go there.
That's actually, I don't know who the person would be either. That's why I just directly called the emergency room because I didn't know what administrator to speak to, you know.
Well, it's kind of interesting because actually you guys already met the person who's in charge of the ER room. And but it goes higher than that. So just hang on and I'll get you some more information because I'm going to a meeting and I'll get back to you because we are going to need to go talk to them. Okay.
Anybody else out there have any questions or comments about today's presentation? I see a lot of pictures of judges in the background of somebody there sitting.
That's my sister.
Okay. That's my sister-in-law. She's a court reporter.
Oh, okay. All right.
It's Chip's sister.
Are you getting it all down? Well, thank you for joining us.
You can't hear
Okay,
it.
ladies and gentlemen, on that note, if there is nothing more, I'm going to also thank you, Renee, on behalf of Flagler OARS. You know how important the Narcan conversation is, and we all know how much work you've done with it. So thank you. I'm also going to do my late night TV ads here. Coming up this evening at 6 o'clock, we have our monthly RCO community meeting. That's going to be an important meeting because we're going to hit consensus on what our big education projects are going to be this year. Then at 7 o'clock, Kim Carney and Zach Rimmer are presenting Zach's story of recovery. Tomorrow at 7 o'clock in the evening, Leslie and Mike are on deck and they're going to be talking about drug court. And then Thursday at noon, Dr. Simonides will be talking about medically assisted recovery and all the ins and outs of that. That's going to be a fun presentation. And then finally, Danielle's up on Friday at noon. So please, if you can take your lunch hour, have your friends take their lunch hours, or in the evenings, grab a cookie, turn on your device and log in and enjoy these bite-sized morsels of learning with us. Thank you, everyone. We appreciate you.
Thank you.
Thank you so
Thank
much, Renee.
Thank you.
Thank you.